Hi everyone. I am sorry about last Thursday. It was pretty unexpected and the class got cancelled just an hour before because I love to talk about the part which I'll talk just in a bit about a lot of injury prevention strategies and a lot of environmental injuries. But let's try to, focus and get something out of this video. With I don't know how long it will last, because I'll try to cover whatever we have talked on Tuesday for a brief overview, maybe 4 to 5 minutes, and then I'll just talk about winding off the resistance training program, how to design a resistance training program which we have started on Tuesday. And then in the second half I'll just talk about a lot of injuries and how to prevent those injuries which are somewhat related to exercise, and a few environmental related injuries at the end. So let's see how it goes. If you remembered about our class on Tuesday, we have been trying to study the principles of physical training and fit formula to design endurance training program and resistance training program. So the first thing which we have talked is about overload, and then we have talked briefly about progression, specificity and individuality. So if you have looked at overload, it's basically an increase in the amount of usual activity to produce stress on your body so that it makes our cardiorespiratory system work more, and this will help to achieve our specific goals as far as exercise is concerned. But we want to make sure that we should be always there in this dark green square, because this light intensity is not going to have any specific health or fitness benefits per se. So we want to move from our level of usual activity into the moderate and vigorous one to get the specific health and fitness benefits. But we want to make sure about this ceiling. We don't want to move into this either by doing some heavy training or by progressing really fast. Otherwise, this sort of overtraining might result into injuries. Then we have talked about progression, why it is necessary to continue progressing in order to have maximal benefits. And whatever exercise we are doing, we have to be very specific, keeping our goals in mind. And genes and genetics have a lot to play, and play a very critical role in our response to exercise. Well, these are some of the example of guidelines: the Canadian Society, the AHA1, and Exercises Medicine. You have links of all these three physical activity guidelines in your textbook. So if you want to go there and try to look for making some sort of a start, these are some good resources to look at. Now we have to choose the activities for our specific clients after making sure that these are the four basic principles of a program. So as far as cardiorespiratory endurance is concerned, we can go for cycling, jogging or swimming. If you are looking for strength training, these are some of the options. And for flexibility, stretching, you can do yoga and all sort of things which involve stretching of our body. And all these factors depend upon the specific goals of the individual, the convenience and the cost, and these other considerations are important to make sure that the program will last long. Now, once we talk about cardiorespiratory training, we will talk about the frequency and the intensity. We have talked very briefly about the talk test. It's a very rough and crude method, but you don't need any specific equipment for that. And then we have talked about these two RPE scales, the rating of perceived exertion, to make sure that whether our endurance exercise is light intensity, moderate or vigorous. Then we have talked a lot about pulse, what pulse is. It's a pressure wave, and you can measure it in resting condition, you can measure it while doing exercise, you can look for specific locations. If you're looking it in your arm, that's the radial. If you're looking in the neck, it's carotid. And these are some of the ranges of normal values for heart rate. For example, if the pulse rate is between 60 and 100, that's normal. If it's more than 100, that's tachycardia, or if it's less than 60, that's bradycardia. Then we have a couple of red flag signs that don't palpate carotids bilaterally, otherwise your patient will pass out, because these are the only two arteries, not only, but one of the big arteries which provide blood supply to our head and neck. And don't use your thumb, because thumb has its own pulse. Then we have looked at this formula very quickly. I just want to go over it, that you need to know the maximal heart rate depending upon the years. Then we measure the resting heart rate, subtract them to get the HRR, and then use this formula to get the upper range and the lower range. Then these are some of the examples of doing all sort of moderate and vigorous physical intensity training, and these are examples which you can decide depending upon the choice of your client and the other factors which we have discussed earlier, the cost, the convenience, and the social considerations, etc. This is just a recapitulation, and then we started talking about resistance training at the end, which says that it's basically meant for hypertrophy and increasing strength. And these are a list of 10 variables which make resistance training work, and these are considered for resistance training. And I'm discussing the ones which are highlighted in red, and we have to remember that all these variables are dependent on the SAID principle, or exercise specific modality principle, that our body is going to respond depending upon the specific exercise modality. So for example, if our aim is to do resistance training, then we have to lift weights. If our aim is to improve our CRF, we have to improve the cardiorespiratory fitness by increasing our activities such as jogging, running, etc. So once we talk about volume, it was very clear that it's sets, reps, and loads. And if we talk about frequency, it's the number of times a particular muscle is doing training. And these are some of the options. You can do full body training every day on 3 weekdays, or you can split it on as far as upper body, lower body, back, or abdominal muscles are concerned. So that depends upon your specific goal, and this can be manipulated using volume. Now then we have talked about load. The most common one which we always talk is about 1 RM, but there exists other load categories as well, depending upon older adults or maybe people who are more prone to injuries. So, and in some of the patients who can't lift maximal loads because of either their injuries or risk of injury, or maybe because of some weaknesses, so we have these other options as well. This is very important, the rest interval length, that what is the rest time between sets. And if it again depends upon your aim, if your aim is to build the muscular endurance, you want these short rest periods, and you want to go for more reps and then short resting periods in between. But if your aim is to become a power lifter or maybe increase your strength, then you want these big rest intervals and use high or larger weights and do less reps. Order is important. You want to go for complex exercises, one which involves a lot of muscle groups, and you want to move towards the simpler ones as you progress, so that you won't get fatigued before moving on to the complex group of exercises. Now, this is what we have talked in our last class on Tuesday. Now, today we will just finish off talking about warm-up, and then we will try to summarize these exercise fitness programs before moving on to the discussion about the injuries. So the first thing about today's discussion is warm-up. The name is itself suggests that it basically warms our body or increases our core body temperature, And the main idea is to prepare our body for a workout. And this will have a lot of benefits. It will improve your performance, it will decrease your chances of getting any spasm or strain or any sort of injuries while training. It will also reduce the chances of getting soreness because the body has already prepped in advance for the heavy workload or the heavy workout which is coming up. Now, once we do different sort of warm-ups, it increases our heart rate so that our heart can pump more blood. It increases our respiratory rate so that more and more oxygen is there in the blood to supply the increasing demand of oxygen for our muscles. It also increases our body temperature so that the muscles are already laden with blood, and that is done by increasing the blood flow. So once we start moving our body, because of the phenomena of redistribution of blood moves from some of the organs, for example our stomach or the GIT or the kidneys, towards the exercising muscles. And this phenomena of redistribution helps in performing a good exercise program. You can do warm up in a number of ways. It may be a very general warm up. For example, you can do some jogging or cycling, or you can have some very specific warm up. For example, you can see here the lunges, the squats, maybe you can do all those sorts of jumping jacks. So it might be a general warm up, or it can be a specific dynamic warm up depending upon the type of exercise which you are going to perform. But warm up is extremely critical as far as starting an exercise program is concerned. Then we will do exercise. That is the conditioning. So basically, it's not written very well in the slides, but if you think about it, it should start with a warm up, which we have just talked, and then the conditioning, which can either be aerobic or resistance, about which we have talked quite a lot in our previous class and at the beginning of today's discussion. And then once the exercise is finished, we want to go for this cool down. And guys, please remember that cool down is almost as important as a warm up, because your body is in a state of high energy balance. It's a sort of thing where everything is increased. You have increased heart rate, you have increased respiratory rate, the blood is there everywhere in the muscles. So you want to give some time to the body to get back to the normal resting condition. And for that, you need to reduce your heart rate so that now there is no need of increased blood supply to the muscles. So the heart will increase its rate of pumping blood. Similar thing is going to have the respiratory rate, the temperature, metabolism, so that the blood will go back just opposite to the warm-up. It should go back from the exercising muscles to all the organs where it's more necessary to have blood. For example, you want blood to go back, most importantly, to the head and neck region, because once we have been exercising, the blood is minimally present in the head and neck region to provide just the minimum amount of oxygen. And that is why if you avoid cool down stretches or cool down after exercise, many times people will pass out because immediately their body relaxes. There is not enough amount of blood in the head and neck. Because of the gravity also it goes down, and because of less oxygen and blood supply, sometimes there is a transient passing feeling of passing out, or sometimes some sort of dizziness, or sometimes headaches can also happen. So please make sure that you allow body to go back to the resting condition by redistributing blood back to the different organ systems. So this is again a reminder that you do a warm-up, then you do the main conditioning exercise, and then you go for the cool down. And this is how the fit guidelines which we have talked briefly in the class, the frequency, intensity, time and type of exercise goes into specific exercise regimes. And we have just finished before the warm-up the resistance training. Most of the recommendations, whether it's the ACSM1 or it's the THHS1, which is the US government health guidelines, it says the resistance training should be done 2 to 3 times a week with a 48 hours interval in between to allow body to recover from the soreness and damage which is caused by the resistance training. And this is a standard set where there has to be 8 to 12 reps, which is some sort of between power training and endurance training, the muscular endurance training. So it's a standard one, and you want to do 2 to 4 sets of these 8 to 12 reps and somewhat 60 to 120 second intervals between the sets. And this should involve all the major muscle groups. Now I think there are a couple of video links here. The first one is Dr. Lockbaum, and you guys are pretty familiar to him because of our guest lecture a couple of weeks ago. He will talk about this FIT program for 5 minutes, so we'll listen to this lecture. And the second link, which I'm not going to play today, but you are highly recommended to see it because it is his personalized video which he has designed to make sure that if you are looking for a 30 minutes exercise program without the presence of any equipment, how you should do it, and he has designed and timed it himself. So it's a good watch. So let's see how it goes.
Hi, this video is specifically about the FIT principle. Hi, this video is specifically about the FIT principle and a typical workout that it's not specific to my book, but I'm talking about chapter 2 in my McGraw-Hill book, Get Active. It's the 3rd edition, not the 2nd, but you usually don't print this. It's an ebook. So I'm going to get right into it. And again, this is going to be linked to a workout. It's always harder with the book because there's a lot of pages. Chapter 2, Basics of Physical Activity, Fitness, and Exercise. And specifically, I want to talk about the section that says a typical workout. In the ebook, that's somewhere around page 45, I believe. 45, 44. A typical workout. Warm up, 5 to 10 minutes. Conditioning phase, 20 to 60 minutes, whatever type of conditioning you're focused on. And a cool down of 5 to 10 minutes. And so that is surrounded within what is called the FIT principle, which is somewhat confusing because it's not exactly, the letters don't stand for exactly the first letter of each thing, each word. Frequency, intensity, time, that's confusing. It's the I in time, not time, and type. And before that, it really should be the FC-FIT principle, because we have which component we're working on. We're working on our aerobics, our heart, resistance, our muscles, flexibility, or some type of neuromuscular balance, whatnot. And so I'm going to read this video specifically is resistance training. It's a full body, 30-minute workout with no weights, nothing. And so if I look at figure 2.15 in my book, it is, I'm going to look at the resistance exercise fitness component. And so frequency, 2 to 3 days per week with 48 hours rest between. Reasonable. Intensity, resistance sufficient to fatigue muscles and targeted number of repetitions, 8 to 12, appropriate for beginning to intermediate exercises. That seems reasonable. Everything is body weight. I don't know your fitness level, right? So maybe it is too easy. If it's too easy, all you have to do is put on a weight vest. That changes the game immediately. If you're beginning, it's 8 to 12 reps, and if you'll see in the video, Jessica does 12 reps. It's on a very reasonable count. It's actually a metronome, 48 beats per minute, 12 reps, and then there's going to be 15 seconds of rest between. And then in the book here, it says, these type of workouts, you should have at least 15 to maybe a minute of rest. It would be a long video if it's always rest, right? If it's always rest, the video becomes too long. For the eye and time, for general fitness, that's what this video is focused on, that this is linked to. 8 to 10 exercises to work all major muscle groups with 2 to 4 sets, again, of 8 to 12 repetitions. And so what we have 13 exercises, so that's more than 10, but because we're not using dumbbells, stretchy cords, or the like, we have to isolate with full body weighted exercises. We're going to work the left leg, the hamstring, lower back, and then we do the right side. For our arms, we do the triangle push-up for our triceps. Then we reverse our hands this way for our biceps. So we have a few more exercises than this recommended 8 to 10, but we really don't, because we have to do a few extra things to target all of our muscles. And then last, it says resistance exercise involving each major muscle group, fatigue for type. And that is certainly going to happen. Again, if you watch it and you go, that's a great workout. It is a great workout. It is a great workout. And I just need it to be a little bit harder. Again, a weight vest. I have an 8-pound one that's 8 pounds, and I have a 25-pound one that you can change in increments of 1 pound, I believe. And again, makes all the difference in the world. And so the video that's going to pop up somewhere, it is 30 minutes, a 5-minute warm-up on a metronome. Again, you don't hear it. We took the sound out, but you can easily follow along. There are a video within a video, or the description to tell you what's coming up next. It's easy to follow. And then the workout starts, 20 minutes, 2 10-minute blocks. So we get 2 sets of each exercise. Again, in those, for sure, you have a video that will pop up of what's up next. Let's say up next, whatever, squats, arms out, and then it'll be there. And then Jessica will give you a 4, 3, 2, 1, start, prompt. And then at the cool down is that flexibility, that and that big breath type of cool down, and it's just easy to follow. So, a typical workout, specifically resistance training, following the FIT principles. As with any workout, as within the chapter, or any type of video, this video is...
Alright guys, so I hope that you found this video really helpful, and you can always click on the link about which Dr. Lockbaum has just talked, and it is about resistance training without the use of any sort of equipments, using the FIT formula. Okay, for this slide, it's just about giving you a couple of templates that how do you keep record or track of your progress. So on the left side you have this one for the aerobic training, on the right side is for the resistance training. I'm sure if you Google you can find hundreds of those. It's just an example, but as far as designing a program is concerned, my point here is that you should make sure that whatever you are doing yourself or with your client, you just have to have a record of their progress. Now, in the next 5 to 7 minutes, I want to talk about some of the general strategies for injury prevention. So we have talked about it, that we need to progress in order to achieve specific goals, but the other important thing is that the progress has to be performed slowly, because any sort of fast progress or if you want to achieve results quickly, that will have a negative impact because of overtraining or potential injuries. We'll talk about how to get some of the etiquettes going on while exercising in the next slide, and we'll also talk about the importance of wearing proper footwear and clothing. This is critical, and it gives you some really interesting insight about shoes and clothing as far as training is concerned. Then we'll talk about some of the safety equipments which we are going to use, and the importance of hydration as well. So let's quickly go. We have talked about the first one. Let's quickly talk about some of the etiquettes through this series of pictures. Now, I know everybody, the pictures which are going to come up, most of you are aware and following these etiquettes. It's just a reminder that actually following some of the very basic guidelines in the gym, or at different places where you can do exercise, makes a world of difference. So I can't wait to work out. Now it's not that common, but before the COVID pandemic, there are some specific times where everybody goes to these gyms, and sometimes you feel that you are waiting too much longer than required, and we'll get agitated with that. But just make sure to wait, because it's important to have your personal space and give others space as well before you go for any sort of workout. This is just about, towel. Bring a towel in order to wipe up after yourself. So just make sure that you have your own towels, and you clean whatever sweat you have on the machines, to make it a point for others, and they won't feel uncomfortable once they are using the same machines again. So please make sure that you are doing this on a regular basis. And this looks small, but it makes a difference that if you are using some sort of equipments, and this is pretty common with weights, just make sure that you put them in the right place, specifically in the order in which they are lying there in the cabinet, or maybe somewhere on the floor. Just make sure that they are in the right order, so that it will be easy for everyone to sort them out once their turn comes. So these are some of the etiquettes which I'm sure you guys know them, you are following them, but just a quick refresher. Now, this is really interesting. We all have been using footwear all the time, but as far as specific training is concerned, shoe size is extremely critical. And you don't want to order it online, which is extremely common nowadays. It's always preferred to wear shoes and feel how it feels while you are walking after wearing a new shoe. So please make sure that you choose the right shoe size. Some people say, and it's written in your book, that you choose your shoe size during the evening, because throughout the day there is some amount of fluid. Because of the impact of gravity, it moves into your feet, and your feet will be just a bit large in the evening. So you don't want to land into a condition where you buy a shoe which fits you well in the morning, and then once you work out or you have a lot of exercise and there is a slight edema or sort of enlargement of your foot because of fluid accumulation, then that shoe is not of optimum size. So please make sure that you choose your shoes most of the times during the evening, once your foot has the maximal possible enlargement. That's something interesting. As far as shoe design is concerned, this is also important. You just want to have some space either forward or lateral, because that depends upon the type of exercise you're going to perform. For example, if you are going for jogging or running, you want this forward space to be there. Or if you're doing sideway exercises, you want some lateral space to be there, just to make sure that you have ab space inside your shoes for your specific foot movements. Toe comfort, again important. You want to leave just a little bit of space between your toe and the front part of your shoe. Now, clothing, again, extremely critical. You want to have the right size, which should neither be too tight nor too loose. It's a famous saying, because if it's too loose, you'll always have a chance of getting it caught somewhere in the exercise machine or somewhere in the nearby equipments while you are doing exercise, or sometimes it's just uncomfortable with clothes hanging everywhere. You don't want it to be too tight, because otherwise once we exercise there's a lot of sweating. So we don't want the clothes to be too tight that it won't allow sweat to evaporate, because that will not only irritates your skin but also hampers the normal um, mechanism of the body to dissipate heat. For the same reason, fabric also has an important role to play. You don't want a sort of fabric which, you know, won't allow fluid and sweat to get absorbed, and you just want it dribbling everywhere. So you want to choose a cotton sort of fabric which gives a light sensation and absorbs a lot of fluid, so that you will feel cool over the skin and helps the body's heat dissipating mechanism to work well. This is also interesting and important, that if you're exercising outside, specifically if it's too hot, then you should have the proper goggles, proper hats or caps, whatever, because even if we are working inside, our body is going to lose water because of sweat. So you make sure that you stay hydrated, have the proper covering on your body to make sure that you are not exposed to too much heat. Or if it's cold weather like it's going on nowadays, then you have apt clothing over your body to make sure that you won't land any sort of frostbite or hypothermia kind of conditions. So clothing is definitely important, keeping in mind its tightness, the fabric, and the exercise, the place of exercise. Hydration, I think, is quite important, because as we exercise, our body loses heat, and the body's normal mechanism to lose heat is via sweat, and that is why we lose fluid from our body. And that our body is composed of almost 60% water. So once we exercise, there is a shift in the fluid and electrolyte balance in our body. So we want to keep hydrated most of the times, because more loss of fluid from our body leads to dehydration, which you feel by concentrated urine, because less amount of water is there for the kidneys to get all those nitrogenous wastes or metabolites or toxins out of your system. And many times you'll have fatigue or cramps if you have electrolyte imbalance. So this is just a suggestion, that you, before 3 to 4 hours before the exercise, you want to take between 16 to 24 ounces of fluid. During exercise, 4 to 8 for every 15 to 20 minutes. And after exercise, you want to replenish all the fluid loss by taking weight. So if you take your weight before the exercise and after the exercise, then the difference is the amount of fluid or the water which your body lost during that exercise. So you want to replenish that amount of water. So I don't expect everyone to remember these numbers. It's just a rough estimate that we need hydration long before the exercise, just before the exercise, which is not written here but it's there in your book, during the exercise, and after the exercise. So taking water in small bouts is a continuous process to make sure that you won't get dehydrated. These are some of the drinks. We always prefer that, unless and until it's a very specific exercise regime, water is the best way to hydrate yourself. But sometimes some sort of drinks which have small amount of carbs in them might help if you're doing for long exercise sessions. Alright, so that was about the FIT program and designing an exercise program, and some of the potential sources to avoid injuries. Now, for the second half of our discussion, I'm looking to talk about, let's see, the last two objectives. So, we want to talk about self-care for some minor injuries and some of the red flag signs once you need to go to a doctor, or if it's an emergency then you want to call 911. And we'll talk about some of the safety concerns related to physical activity or exercise in extremely hot conditions, and here I'm going to talk about heat exhaustion, heat stroke, and during cold environmental conditions when we talk about the hypothermia and the frostbite. And very briefly at the end I'll just touch on the air quality issues. So let's talk about some of the self-injuries, which is a big part of our discussion from now on, which is treating minor injuries. So we'll go over them slowly. If you see the first picture, this is about blisters, and blisters are extremely common. All of us have experienced it, and most of the times they just heal on their own. But I'll just want to briefly talk about that in case you want to treat them yourself, what are the potential options. So the problem here is that if there is excessive rubbing or continuous irritation of the skin, then you might see these blisters. It might be in this form, and it might be in this form where you have some sort of fluid inside it. So the first thing you want to do is that you try to drain the fluid, taking some of the aseptic precautions. So first you wash your hands with soap and water, then you wash the area where you're going to try to drain with soap and water. Then try to apply some sort of iodine solution over it, and then you try to prick it with a needle, but that needle has to be sterilized using some sort of alcohol wipe. And please make sure that you let the alcohol dry, because alcohol has its sterilization or antiseptic action maximal once it's dry. Don't try to immediately wipe and try to prick. So once your needle is dry, then try to make a single prick somewhere in the middle, and then try to press it to get all the fluid out. Then dry it with some cotton or some dry gauze piece, and then apply some antibiotic ointment over it, and either use a non-stick gauze and cover it, and if it's very small you can leave it open as well. So this is how you treat minor blisters. Anytime you feel that it's getting infected, it has pain, or there is some pus or some sort of suppuration coming out, then try to consult your physician immediately. Let's talk about scrapes. Scrapes are minor injuries or abrasions. Maybe if you fell somewhere or you have a minor cut, but this is mostly confined to the top layer of the skin, which is epidermis. So if you have some sort of injury like this, the first thing you want to do is similar to this one, that you wash your hands first, and then you try to apply water. Don't try to apply soap over it, because it's an open injury, so you might have blood and soap is going to irritate it. So you just avoid putting any sort of soap on it, and just put it under water. Try to get rid of all the dirt or whatever is there because of the cause of injury, to clean it. And cold water, maybe at a temperature some sort of 60-65 degrees, will be really great to clean this up. And then if it's bleeding, then the best way to stop bleeding is to apply pressure. And don't apply for a quick few seconds. You need to apply it for 30 seconds, 45 seconds, sometimes 1 minute. It will take time for bleeding to stop. So if it's bleeding, just make sure that you apply pressure and stop the bleeding first before going for any treatment. Once you have applied pressure, the bleeding is stopped, the wound is clean, then you can just go for cleaning with some sort of iodine solution. That's the best antiseptic one for all these sort of small injuries. And you clean it, and if it's not very deep, leave it open, because if you close it, most of the time, unless and until it's very deep, it will have a lot of moisture, which encourages the growth of microorganisms. So you want to leave it open, and it will heal on its own once you have the development of all sort of fibrous tissue. After cleaning with iodine, you sometimes want to apply some antibiotic ointment, some sort of betadine ointment or enzamycin ointment, whatever is available over it, just to make sure that there won't be secondary bacterial infection. Okay, this is also interesting, pretty common, chafing, or maybe it's very commonly seen in babies, and they say it as a diaper rash. This is again due to irritation. So this is not any sort of injury, it's just irritation. And once it's too tight clothing where there are anaerobic conditions, then it encourages the growth of a lot of bacteria, or many times other microorganisms, the fungal ones, and you'll see all these sort of things. So the best way to treat chafing is to just clean it with water and soap and make it dry, because moisture is the biggest culprit here. So you can apply some sort of powder and keep that surface dry as much as possible. That's the best treatment to a chafing or diaper rashes. Calluses, somewhat a sort of chronic injury, and there are this is, if it's that big as shown in the picture, that's a callus. If it's very small, it is sometimes said to be as corn, and the treatment is the same actually, because the problem is that because of continuous pressure, because of a shoe which is too tight, or for not wearing socks or walking on surfaces which are too hard, this will result into a lot of what I just want to say, maybe loss of apt amount of blood supply here, which results in some sort of fibrosis, and this fibrosis makes this superficial tissue dead. So you just want to apply some sort of padding to it, and you can also apply some moisturizing creams or lotions to keep it moist, because because of a lot of pressure, there is not apt amount of hydration of this area, which results into dryness, which converts the normal epidermal tissue into this fibrous tissue. So if it's a small, it's a corn; if it's a big, it's a callus. But providing moisturizer is the key of treating calluses. I know I've talked a lot about these blisters, striates, chafing, and calluses. You might not find all this information in the books. I just thought that it's very common, so we should spend at least some good 10-12 minutes talking about some of the common strategies to treat these injuries. Okay. Let's talk about some of these 3 common injuries which are really seen once you're exercising: the sprain, the soreness, and the strain. And I found this picture very cool because it is a good acronym to remember. That PRICE is protect, what is our first priority actually. Rest, another important thing, because it allows body to redeem and get back to normal itself. Ice is another important thing which you want to apply if there is a sprain or strain. You also want to make that area immobile by putting some tight sort of crepe bandage, or tying a cloth or something which makes the area immobile, and compress it to avoid swelling to occur. But just make sure, it's just a red flag sign, don't compress it too tightly, because if you compress it too tightly, then it won't allow the normal fluid to move, and it might have a negative impact. So just try to get the area compressed moderately and make sure that it is as immobile as possible. Elevation is another interesting thing. So we elevate a lot of lower limb surfaces just to make sure that there is no edema which develops. So you can put some pillows and keep the leg or the lower limbs elevated, so it won't allow the fluid to accumulate in the feet, because it's common for fluid to accumulate because of the effect of gravity. And if there is an injury because of the inflammation, a lot of fluid seeps from the blood into the surrounding subcutaneous tissue, and you have swelling there. So it's because of the inflammatory cells and the inflammatory reaction at the site of injury which leads to the accumulation of fluid or edema. So we want to compress it, elevate it, to avoid this to happen. So if you can just remember that we want to give rest, put some ice to avoid pain, or compress it or elevate it. So these are some of the common strategies to treat sprain, soreness, and sprain, although specific treatment depends upon the extent, the area of injury, how bad the injury is. So there are some specifics. These are some of the general common strategies. Well, now we are moving from some of the things which are pretty common and easy to treat to some things which are, more serious and needs medical attention most of the times immediately. For example, if it's a fracture means that there is discontinuation in the bone, and there is breaking of bone. It might not be a complete break, deformation of bone, but it might be a hairline fracture, but there is change in the continuity or the integrity of the bone. Concussion is about head injuries. So it's very common in boxers once they get those, boxing shots on the head. So the problem is that once, you are hit on head, then the brain inside the skull is not very tight, or it's not attached to the skull or the cranium. It's basically floating inside our cranial cavity, inside the CSF. So once you hit this area, then because of the pressure, the brain is going to go on the other side of the head and hit the bone, and then it comes back. So this hitting of the brain tissue, which is very soft, on the hard cranium, that results into concussion injury, and immediately you have accumulation of fluid. That accumulation of fluid compresses the brain tissue. That's why you feel headache, you feel dizziness, you sometimes pass out, and all the treatment which is given for concussion is to reduce the edema inside the head or accumulation of fluid because of inflammatory reaction. One of the key signs of identifying fractures are the next two. There is severe tenderness. You even can touch and it will cause severe amount of pain. There might be immediate development of swelling. I understand that swelling develops in any sort of injury because that's a normal response, but the swelling of fracture is big and too painful and too tender. And sometimes if you suspect that there is a fracture of any part, you ask the patient to move that part, something like this. If just with a slight bit of a movement there is immense pain, or he can't move it at all, you should suspect fracture, because the movement is completely, or at least to a larger extent, compromised if there is a fracture. Sometimes you have these sensation, the tingling sensation, or some prick like sensation, or there is numbness. You feel that you are not feeling, as kind of an anesthesia sort of thing. And sometimes there is coolness because the blood supply is compromised, so that area is not supplied apt by the blood, so that turns pale, cold, and you see all these symptoms which tells that there is either a nerve injury involved or there is a vessel which is injured. So these are some of the signs that if you find in a patient while doing exercise, ask him or her to consult the doctor immediately, because that might be a serious problem. Let's talk about the effect of environment, and first we'll talk about the hot weather. Heat rash is pretty simple. Heat rash means that once we sweat excessively, some of the sweat glands or pores in our skin, they just get blocked. So sweat just can't escape from the pores of our skin. So if it can escape, then it accumulates and you will see some small red rashes on the skin. Those are heat rashes. So that's not a big problem. You can just apply any antibiotic ointment or maybe clean it with soap and water and it will go away. Once you have a heat cramp, so heat cramp, heat exhaustion and heat stroke are the three stages in which heat injuries progress. So this is the mild one, this is somewhat serious, and this is definitely a medical emergency. So we'll look into it here. So if we talk about heat cramps, it's basically a spasm of a muscle, and it can occur anywhere in the body where muscles are involved. The first thing I want to highlight is that the exact cause of heat cramp is not known, but it's mostly related to some sort of electrolyte balance. So if you have electrolyte balance, you lose more fluid, you are not taking it proper water and electrolytes, you are likely to have heat cramps. So the best idea is to maintain the core body temperature, and go back to a cool place, drink a lot of fluid, do some sort of stretching or um, exercises to relieve the spasm. Now, if it's not treated and the condition is getting worse, then you have heat exhaustion. That's the next stage. At this point, it has to start showing effects on your central nervous system as well, and there is weak pulse and rapid shallow breathing. So basically the system is trying to cope with this abnormal condition, and the core temperature of our body, which is inside, not on the skin, is getting more and more, and the body's heat dissipating mechanisms are not working. Although you'll find heavy sweating because body is trying its best to remove heat from the body, but it's not completely working, but still you have sweating going on. And why I'm emphasizing this point, because once the sweating mechanisms failed completely, then you land from heat exhaustion to heat stroke. And the treatment is pretty similar. You want to move the patient to a cooler place. You want to loosen the excessive clothing, just allow body to lose as much heat as possible. Cover it with wet wet clothing or water, so that the temperature might go down. Try to give a lot of fluids, and seek medical attention if it's an emergency. Heat stroke, as I've just pointed before, it's a condition where the body's ability to cope with too much heat inside just fails, and that is why you either have profuse sweating in the beginning, but you might have hot dry skin, and that's a really dangerous sign that the body is too much hot inside, but still it can't lose heat. So it means that you are landing into a heat stroke, and this is the active involvement of central nervous system symptoms. You have altered mental state, you have dizziness, confusion, slurred speech, your orientation is not proper, and you have high temperature, your pulse is really high, you might have vomiting, and sometimes you lose consciousness, because once these CNS symptoms exceeds the coping capacity of the body, you are gonna lose your consciousness. So that's an emergency. Call 911 immediately. It is a medical emergency, and if you won't provide apt care immediately, the patient might die. And the other problem is that do not try to give fluids, because if the patient is unconscious and is not responding and he's having vomiting, he might aspirate those fluids. So don't try to give fluids, because in the hospital they are going to administer it through the veins, so you just can't give it orally. So I think I just talked briefly. There are a lot of other points about these medical emergencies as far as excessive heat injuries are concerned, but I think this is a good workout about some of the things which we have just discussed. Cold weather, nowadays it's too cold outside, so make sure that you don't exercise even now in the daytime also, but try to stay inside, stay dry, dress in a lot of layers, keep yourself hydrated, because many times if it's too cold we won't feel thirsty, but the body still gets dehydrated. The biggest difference between hypothermia and frostbite is that in frostbite, it's our core body temperature which goes down below 95 F Fahrenheit or 35 centigrade or 35 C. So the problem is that the body is not able to maintain the normal temperature. It's just opposite to the heat exhaustion injuries. So body has to have a temperature of around 97 or 98 degrees Fahrenheit, but if it goes down below 95, that's an interesting number, it's hypothermia. So once the body's temperature is low, the core body temperature, it's sensed by the hypothalamus, a few of the nuclei of hypothalamus, which regulates the temperature of our body. So they feel that the temperature is down, so we start having, we start shivering, and our body try to do some sort of activities to generate heat. So these are some of the signs of hypothermia. Frostbite is specifically related to skin. So if you go out in a temperature which is too low, then first it's the layer of the top layer, the epidermis, which happens, so you will feel some redness. So if you have your a lot of negative temperatures outside, then you have redness on your skin. That's the first sign, but that's only limited to the topmost layer. A time comes once this injury goes deep, then you have white colored areas. It means that now there is involvement of some sort of dermis and the deeper tissues, and if the whole area goes dead, it will be a black area. So these are some of the stages of frostbite, and the idea is to provide warmth as soon as possible. Try to pour warm water, or try to put it inside hot water, or and if it's already a frostbite, then it's an emergency. You have to consult the doctor, because there might be some necrosis going on, so just make sure that it's not as bad as it's a black area. So these are some of the environmental injuries which we have talked. The last thing about this discussion is the air quality considerations. So I'm not very much interested in knowing a lot of details, as long as you know that a 0 to 50 quality is good, and if it's more than 301 to 500, that's really bad, and it's a big, very bad quality air. That's okay. So these are some of the scales to measure it, but these are some of the values through which the air quality is decided. So that's the end of our presentation. We have talked about a lot of things in our module 2, and I'm really hoping that we will have an in-person class on Tuesday, so that I can go over the whole module 1 and 2 really quickly before our exam on Thursday. And this is my whole idea, to have an in-person review. Personally, I wanted to teach and talk about all these injuries and their preventions in person, because it will make more sense if I'm standing there and talking face to face. But it was unfortunate, and I'm really hoping that we'll have our exam review class on Tuesday, and then we'll go over the stuff of module 1 and 2 before you give your first exam about 1 and 2 on Thursday. I hope I know it's a long video, it's tedious to watch every bit of it, but I hope it will be useful. You can watch it now, or maybe just before the exam, whatever suits your schedule. And I hope to see you all on Tuesday. If you have any questions, feel free to shoot an email, and try to respond as soon as possible. Thank you very much for your time.